Jason Westin presented a very dynamic, very interesting study at this meeting looking at the introduction of targeted therapy in untreated diffuse large B-cell lymphoma. So R-CHOP has been the standard of care for the management of large cell lymphoma for a number of years. And even at this meeting, there was another challenger, meaning there was an R-CHOP plus drug X, and that drug X was lenalidomide in the ROBUST study. And there were some issues in terms of getting patients on treatment fast enough, but at the end of the day, there was no difference in outcome between the lenalidomide plus R-CHOP versus R-CHOP study. So again, establishing still in 2019 that R-CHOP is the preferred treatment. What Jason Westin did is he did a lead-in of lenalidomide plus ibrutinib, trying to harness the synthetic lethality of the combination, pairing it with rituximab, and after 6 weeks, no chemotherapy, he had a response assessment done and showed nearly 40% of patients were in a complete response with just the targeted therapy. Now, this is sort of hypothesis generating, so all patients received either R-CHOP or R-dose-adjusted EPOCH, and the lenalidomide and ibrutinib was continued through the 6 cycles of treatment, and his responses at the end of 6 cycles was phenomenal. So very high complete response rates. Nearly every single patient had a response, and so that now generates a lot of questions. We just saw phase 3 data that suggests lenalidomide plus R-CHOP is not better than R-CHOP. The Phoenix study was reported earlier this year that ibrutinib plus R-CHOP is not better than R-CHOP, and now you have this combination of ibrutinib plus lenalidomide, striking response rates. How do you design your next study? That's now the question.